Hey, we're going to open it up to Q&A now. I'm going to start though, you know, we've got this digital health competency webinar tomorrow. And I know Elliot is co-chairing it with, co-moderating it with Dr. Ricardo Silva, who's on vacation at the beach right now and with his family, and that's where he should be. But, and Elliot's always teaching, always moving, and he was with us a little bit earlier, but had to move on. Luis, you want to tell us a word about it?
Sure. So in our Facebook page, which is facebook.com/CED IFMBE, you can find tons of invitations and materials that we're promoting. So be sure you head out to our Facebook page and like our Facebook page so that you can get access to all these news. And well, speaking of tomorrow's webinar, we will address digital health, which is the use of digital medicine to improve patient care. We have great presenters from Canada, US and Germany as well. And we have Elliot and Ricardo moderating this great event. It is going to be tomorrow at 11 a.m. Eastern Time. I just put in the chat of this Zoom meeting the invitation, and we will be sharing it today as well through our social media. So hope we see you tomorrow there. It's going to be really, really interesting, and this will not be the only webinar that we will be hosting. We will be having one as well with Dr. Yadin about how to write a research paper as well, so we can get great knowledge on how to do all this great work in order to promote the knowledge that you guys are doing throughout your work.
And that's August 26th.
Yes, August 26th, we will be sharing that information as well.
Thanks, Luis and Yadin and Caleroy. I'm going to address a little bit of the questions, but it's really a team response here. So Rosanna was asking, what are two priorities for clinical engineers to improve health technology management leadership responding to COVID? And, you know, so you saw our network, a knowledge network and all that stuff. I would say be aware. You know, read as much as you can about what your colleagues are doing. And then implement. Find a way to use that new knowledge and that awareness that you've gained to make a difference, you know, locally or globally. And now I'm going to tell 3 quick stories of your colleagues that are doing this. And one of them is going to be embarrassed because she's on the line. But let me start with Tazeen Bukhari. Tazeen is a clinical engineer, educated in UK, I think a master's in clinical engineering or biomedical engineering, but is a clinical engineer at some leading hospitals in Pakistan. But she's been wanting to make a bigger difference. She's listened to all this COVID stuff. In August, 1st of August, she was assigned by the Ministry of Health of Pakistan to do the gathering of the critical equipment inventory for COVID-19 for her country, that Adriana, the survey that Adriana and her team created. So there's a clinical engineer that's being aware, is trying to make a difference, and then she's gone to implement at a bigger stage than she ever had before. So that's the Tazeen story. Another story is the question asker. Rosanna Rivas is this incredible resource, not only in the country of Peru on the public side and beyond, but she's become a voice for COVID-19 in the Latin American and Caribbean region with her many presentations and her encouraging of others, her work with Toby Clark at the WHO Collaborating Center out of Vermont that's teaching across Latin America. So she's listened, but she's taken it further and implemented new roles in her job to make a difference for others. And then the one I wanted to embarrass was Shauna Mullally from Canada. Hi, Shauna, who was tapped as you know, she serves in Northwest Territories, Canada, not an easy place sometimes, part of the year to be, a little chilly. But then she was in West Africa for a long time and other parts of Africa for the for THET, Tropical Health Education Trust. But she's been a clinical engineer on the move around the world making a difference. So what has she done lately in the context of COVID-19? Well, she was a consultant with others to take all that knowledge and awareness and create training scripts for WHO. It took several weeks, I think, did that on top of her day job to get that done. And she could tell you more and more stories about that. But these are people, to answer your question, Rosanna, that became aware and then took that awareness to a new level to make a difference. So those are some responses that I would recommend for all of you. And then our colleague in the MENA region, you know, So Tazeen is an example in the MENA IMRO region of someone who had knowledge and took it to a higher level to the decision makers. That's a building process. That doesn't happen in a day, but hopefully things like our COVID-19 IMRO MENA webinar last month around COVID-19 learnings will help people like yourself, anonymous attendee that asked this question, how to get more involved locally and globally or nationally in these decision-making discussions. Back to you, Luis.
Tom, let me just...
go ahead, Yadin. Hey, cool tie, by the way.
Let me just jump in and help with Rosanna's question, because I think it's very important for everybody that is listening in. What might be the two priorities for clinical engineering to improve health technology management, she's asking, and leadership output, responding to COVID needs? Number one, in my opinion, would be to show the relationship between what clinical engineers do and patient outcome. If we just do asset control, if we just service and we just repair, but we don't demonstrate that we have better patient output, we will never make a progress. So Rosanna, number one is let us show the relationship between our profession and improving patient output by talking about it, doing the success story that Tom did a couple years ago, and by publishing about it. Number two is to demonstrate that we do have preparation and competency, that we do have education, and that we are, quote unquote, specially prepared group of people to take responsibility of the task. And we're not doing enough by allowing everybody that comes into the door to be called clinical engineers, regardless if they are competent, regardless if they are trained or not. We need to highlight that this profession has something unique, and the uniqueness is training, education, and experience.
Yadin, keep going and talk about Global CE Day. That was another question out there. Please.
The question that Rosanna asked about COVID-19 is shedding light on wider field, and that's the overall recognition for clinical engineers around the world every day, every year. And we felt that we have an opportunity to contribute to elevate the recognition by picking up a day that happened to be the day we thought about it while we were in China, in Hangzhou, in 2015 on October 21st, and that's how the Global CE Day came about. And we selected this day to celebrate what is the contribution and the good things we do for improving patient outcome around the world. And we are on October 21st, once again, every year, 2020 included, we will hold an event that will start in China, because that's where we started with the idea, and will revolve around the world just like the Olympic torch, passing from country to country, giving opportunity for each country in their time zone to tell the story, the success story of clinical engineer, elevating professional recognition, let other professions know about it as well as the public. It will be open on streaming video, and I hope that everybody will contribute material towards that.
All right, so this year it's going to be October 19th. That's a Monday, because we try to do it the week around October 21st, and that's a good time. And Yadin, tell them why.
We're trying to select a day that is accommodating everybody's culture. We have people that have conferences tied to a weekend. In the United States, North America, usually the conferences are in the middle of the week. So we try to find a day just touching the weekend and maybe beginning of the week to allow everybody to participate to the maximum possible. This year, we're going to add a new twist, and that is the award ceremony for the best clinical engineer for the best clinical engineering team and for the best clinical engineering manuscript will be announced during Global CE Day and physically will be awarded in the 4th International Clinical Engineering and Health Technology Management Congress in September 2021, and next to Mickey and Luis in Orlando.
Great. Yarina, I wanted to add also that Global Clinical Engineering Day is an important celebration for all professional clinical engineers. And we will be promoting on ways that you can help out. We will be needing much of your help because it's a day also of awareness. We want to not only talk to ourselves, but also talk to key stakeholders, Ministry of Health, etc. So we want to get that hype of a clinical engineer to people that may see us as, not as important professionals. So we want to change that perspective, and Global Clinical Engineering Day is a great day to do that. So we will be promoting on our website ways that you can get in touch with us so you can receive materials. You can also see what other countries are doing. And it doesn't matter if in your country there's not an established society, as you may gather up with your friends that are clinical engineering professionals, biomedical engineering technicians, so that you can do a small celebration or a medium or a big celebration. And it doesn't have to be anything fancy. You can get maybe gathered in a university, in a hospital, do some presentations about the works that you've been doing, what is the lessons learned, what is the best practices, and it's a great opportunity. I mean, the last editions of the Global CE Day have helped us a lot understand what the points of focus may be in each of the regions. And Tom, I would like to address regarding that point a specific question by Fabiola Martinez about the regions and the activities coordinated by the CED. So maybe this could clarify as well who to get in touch with for the Global CE Day celebration as well.
Well, I'm going to start, but I want you to open Fabiola's mic because I want her to talk about things from her perspective. Now, Fabiola, in Mexico and a board member, and as you already heard, part of the leader of the global credentialing work that we're doing. But we've just encouraged the regions, the 6 regions of the world through WHO's eyes, the definition of regions, to have, if possible, monthly meetings. And the Americas has done a fantastic job in 2020 on that. The most recent one was in Colombia, and Beatriz Galeano brought together this amazing team to present a couple weeks ago about innovation in the context of clinical engineering in Colombia and the university system, Colombia and beyond. So, Rosanna's been a part of that, Marcelo in Argentina, and I know, Brazil has been a big part of that. So, I don't know if Fabiola's mic's open, but she could respond.
Oh, thank you. Thank you so much for the opportunity. My question was about explaining and sharing all the efforts that from CED has been doing through all the regions in the world to organize our work, our activities in order to add results to the CED, to the clinical engineering community. I think it's important to enhance this kind of work because it's a group effort. Yeah, in Americas, in Europe, in Asia, everybody is working in solitary, but also in groups. So that's why I wanted to mark out these kind of activities that as important one, and one of the most important activities that we've made is developed in this year, and hopefully to be on the road for the years coming.
Fabiola, maybe while you're got the mic, what does that look like for the Americas from your perspective? What has CED's coordination look like for you?
It's been amazing how the people get involved actively in this kind of activities. I've seen by the WhatsApp chat group, how everybody is trying to their results and everything to the questions that we deliver, and also in the meetings how the efforts are being released. Last meeting held by the Colombian College was very special because they not only shared the results, but also their enthusiastic efforts and the passion for the work they're doing. That's why we are trying to gather all the efforts, not only from Colombia, but also from Peru, Mexico, and everywhere in America's region, to collect these results in a publication. We are trying to organize this one with your help, of course, and with your leader, Jadin's, and your leader comments and guides to release as something very, very, how do you say, a product, a very specific product to be shared by our stakeholders, our key stakeholders, to be seen, to be observed, and to have a presence on this important issue we are dealing with this year.
And Tom, this is a two-way street, because I would like to recognize that not only what CED is doing for Central, North, and South America, but what they are doing for the rest of the world. And the example is giving recognition for Fabiola being the chairwoman of the award committee and leading it so effectively, and the selection process and the candidates review. I just like to thank you, Fabiola, for leading that very important recognition called the award committee of CED.
Thank you, Jadine. I think it's an honor for me. I'm sure it's an honor for me to be part of this important committee, because as we've seen, all the efforts must be released, must be shared, but also all the great efforts must be awarded. That's why this is a very important task. I'm very honored to be part of this, and this year will be very, very interesting, because we've received a lot of not only article journals, but also the conferences were full of very important papers. So this year is going to be kind of difficult, but we're going to do it well.
Thanks, guys. We're going to move on to some other discussions. Luis, so the activities in the regions, the CED is encouraged, take many forms, and some of the regions are very far down the street, like the Americas are, and you've heard about that. And I talked about earlier about IMRO and Middle East North Africa, that they were less organized earlier in the year, don't have as many national societies, but we over the last 6 months have created a steering committee and worked towards an event that began to bring people together. And that was the, July 22nd IMRO MENA COVID-19 event, which, so back to my friend that ask about, clinical engineers are not recognized in that region yet in the decision-making roles, but they can take the results of that event, which by the way is a YouTube playlist, and put different pieces of it that are relevant into their leaders' offices and into their hands, and say, this is the kinds of things clinical engineers are doing, that are relevant to that local situation. So in the other regions, there's a variety of activities going on. We heard in the Southeast Asia, there's great things going on in Japan. I know Tomo's on this call, and the JACE group, the Japanese Society of Clinical Engineering, with its 25,000 members, has had several COVID-19 events in that country. Also in, actually that's Western Pacific, and the Southeast Asia. Think of India. Of course, we've heard in the June webinar, or actually the July webinar about innovation. We heard Dr. Jatendra Sharma talk about this incredible work through the AMTZ around COVID-19 manufacturing. We heard from Bangladesh on our What's Up group, our colleagues Anwar and Mohammed there, and others, that the Minister of Health has said, oh, we need more clinical engineers to address COVID and ongoing. And so they're hiring many more clinical engineers. So CED doesn't take credit for this. We're just aware and encourage and help each other you know, get our stories out and get our voices heard so that we can make a difference. I love Roberto's question, and Luis, I'm gonna give it the floor back to you in a minute. The WHO director, you know, the Director General, the DG they call him, is from Ethiopia, and he's been so transparent with all the issues around the world. I think he's doing an incredible job, and he's got a wonderful team around him, of course, including Adriana and more. And, you know, Adriana, as you already heard me say, in mid-May said, hey, this morning we had 13 presidents or prime ministers stand up and say, ventilators and help. And 130 ministers of health stood up and said, ventilators and help. So this is our time to respond. But Roberto's asking the question, hey, CED, let's go ask the DG, you know, to recognize clinical engineering. And so, yep, that would be a great idea. I mean, that kind of thing's happened in Mexico with the Minister of Health and the, you know, the WHO rep there. But anyway, back to you, Luis.
Well, we have no more time for questions, but I left here at the chat our website, which you can go to at any time. It has a lot of resources that would be important for you to check out. And you can also send us your feedback, also your questions, and also if you need guidance, you can also write us an email to info@ced.ifmbe.org. For now, it will be everything from IFMBE CED today. We thank very much the people that were here online with us through Facebook and also through Zoom. We thank very much Dr. Yadin, Kelly Roy, and our chairman Tom for this great opportunity to share a little bit about what CED has done. This 1 hour, I believe, makes no justice for all the work that CED has done throughout the past 2 years. But hopefully this will encourage you to get in touch with us, participate in the events that we have. And please, it's very important for recognition as well, so that you help us share this material, share what CED is doing, so we can get to more CED professionals, and also, and very importantly, to key stakeholders in the Ministry of Health and hospital directors. Thank you very much, everyone. We hope to see you in tomorrow's webinar and also in the Global Clinical Engineering Journal's webinars to come. Thank you very much.
And way to go, Bassett in UK. Great chats, brother. See you later.
Bye-bye.
Thank you all. Bye-bye.